Hello and welcome to presentation about history of coronaviruses. Actually, I want to talk today about coronaviruses from different view, or by another word, history view. So let's start. The learning objectives from this presentation is how to know background on SARS and MERS, and introduction about novel COVID-19 infection pneumonia. Coronaviruses are non-segmented, enveloped positive sense, single-strand rinonucleic acid viruses belonging to the Coronaviridae family. The human coronaviruses, first characterized in the 1960s, are responsible for a substantial proportion of upper respiratory tract infection in children, according to this paper. We have 6 types of coronaviruses identified that cause human disease. 4 of these have mild respiratory symptoms, whereas the other two, SARS and MERS, have high mortality rates. This patient is 24-year-old with confirmed diagnosis of SARS, severe acute respiratory distress syndrome. The admission frontal chest radiograph showing subtle changes of ground glass opacity at the basal and subpleural distribution, which appeared more pronounced in the later chest radiograph done after 24 hours, with patchy areas of consolidations in that patient confirmed diagnosis of SARS. So, what is SARS? SARS means severe acute respiratory syndrome, sometimes called SARS-CoV. SARS coronaviruses was first recognized in 2003 after a global outbreak originating in southern China. The virus spread to 29 countries globally, affecting 8,422 patients, with a mortality rate reaching about 11%. The transmission of these coronaviruses occurs via large droplet and direct inoculation. The virus may remain viable for up to 24 hours on dry surfaces, but it loses its infectivity with widely available disinfectants such as Clorox and formaldehyde, according to this paper. Another patient of SARS, 48-year-old man, presented with this chest radiograph, which is showing subtle areas of consolidations and the ground glass opacities at subpleural distributions all over the right lung fields and in the middle and lower zone of the left lung, sparing that area only. Chest CT done later showing multifocal areas of ground glass opacities with sharp demarcations of the abnormal lung from normal lung at all lung fields, as we see here. So the next is MERS, Middle East Respiratory Syndrome, which one type of coronavirus infections was first reported in Jeddah, Saudi Arabia, in 2012. Since then, approximately 2,500 laboratory confirmed human infection have been reported in 27 countries, with a mortality rate reaching more than 30%. The risk of transmissions to family members and health workers seems to be low, despite the potential for epidemics. Through Hajj pilgrims in Saudi Arabia, there has not been a notable outbreak recently. It seems that, in contrast to human pathway as the main route of virus spread in SARS coronaviruses, the MERS coronaviruses occurs mainly through non-human zoonotic sources like bats or camels. Another patient of 44-year-old man confirmed diagnosis of MERS, Middle East Respiratory Syndrome, shows multifocal areas of ground glass opacity in subpleural distribution upper zone, with peribronchovascular distributions in the middle zone and lingular. There are also areas of consolidation in the basal areas and interlobar septum shown in the middle lobe and lingular. There are also effusions noted in the major fissure. MERS. In 83% of patients with MERS coronavirus infection, initial radiography will show some degree of abnormality, with ground glass opacities being the most common finding. Likewise, CT will show bilateral and predominantly ground glass opacities with a predilection to basilar and peripheral lung zones, but observations of isolated consolidations 20% or pleural effusion 33% is not uncommon in MERS. Another patient of COVID-19, 50-year-old confirmed diagnosis of COVID-19 shows multifocal areas of ground glass opacity in subpleural distribution and basal distribution. What is a COVID-19? COVID-19 is coronavirus infected disease and called SARS-CoV-2. In December 2019, a new type of coronavirus called COVID-19 was extracted from lower respiratory tract samples of several patients in Wuhan, China. These patients presented with symptoms of severe pneumonia, including fever, fatigue, dry cough, and respiratory distress. Patient, 31-year-old man with positive COVID-19 pneumonia, presented with low-grade fevers and a productive cough. The initial chest radiograph shows subtle areas of ground glass opacity in subpleural distribution, which confirmed by HRCT done 24 hours later. There are multifocal areas of ground glass opacities in subpleural distribution in the upper segment of the lower lobes and the basal area also. There are subpleural lines and the focal area of consolidation. Novel COVID-19 infected pneumonia, this is another name, NCIB, is believed to have originated in a wet seafood market in Wuhan. The mean incubation period is estimated to be 5.2 days, which allows air travelers to spread the disease globally and become pandemic later. It's an example for case 46-year-old man with positive COVID-19 shows multifocal pulmonary duels in the middle lobe and lingular, superior segment of the right lower lobe, also right lower lobe, with surrounding ground glass invasive halo sign. The chest radiograph also showing subtle abnormality. In this done in Wuhan in February 2020, more than 1,000 cases. The study reported that more than 580 patients with positive RT-PCR and positive CT, and that reflects the high sensitivity of HRCT in diagnosis of COVID-19. However, presence of 308 patients with negative RT-PCR and positive CT raise the possibility of non-specificity of the HRCT in diagnosis of COVID-19. There are also 21 patients with positive RT-PCR and negative CT, which meaning CORADS 1 highly unlikely because normal HRCT. However, still there are possibility of diagnosis of COVID-19, even HRCT is normal. And that nowadays, 22 Aprils, more than 2 million and 500,000 confirmed cases all over the world with COVID-19. Fortunately, 591,000 are recovered. At the end, I want to just summarize some important vocabularies related to the disease. Outbreak, meaning spread of infections in a small area, like SARS coronavirus was first recognized in 2003 after a global outbreak originating in southern China, small area of country. If the disease are transmitted to larger area, it's called epidemic, despite the potential for epidemics through Hajj pilgrims in Saudi Arabia. There has not been a notable outbreak recently. If the disease spread all over the world, so it's called pandemic. The WHO declared COVID-19 a pandemic. That is my reference, and thanks a lot.